Hello, this is Dr. Jyoti. As you know, veneers can be used to correct size, shape, shade, inclination, and even small gaps can be corrected. There are multiple steps in doing veneers, and today we'll see how these steps are done and why are these important. After consultation, once we have determined that veneers can actually improve your smile, then the process starts. What you see on the screen is the impression being taken. This impression is very important. It acts as a reference point and all the corrections are planned on this. How? We will see in the next step. Here you see a white wax mock-up, and this was made using the impression that we created in the first step. This wax mock-up helps you visualize the corrected smile, and it also gives you the opportunity to change anything or modify anything as per your liking. Apart from the shade, anything can be corrected. After you have visualized and approved wax mock-up, we create trial veneers in your mouth. What you see here is a temporary veneer material being used in a putty index to create trial veneers in mouth. These trial veneers step is very important. One, patient can visualize the final smile. Two, it acts as a reference point to control the shaping or contouring that we have to do for the final veneers. It also helps in limiting and restricting the shaping so that we are not over preparing and over trimming.
छोटे लग रहे हैं छोटे नहीं, देखो आपके ये लेंथ बोल रहे हैं छोटा लग रहा है, ये नीचे वो तो अभी कॉन्टूर होगा, बस ऊपर का देखो वो नीचे का तो ये देखो यहाँ से वो टेम्परेरी थोड़ा हट गया है इसलिए लग रहा है वो मैनेज हो जाएगा.
As you can hear, patient is asking for certain corrections and changes in the trial. Now comes the shaping or the contouring of the teeth, and we use special depth gauge burrs so that we can achieve just 0.2 to 0.3 mm of contouring. After teeth preparation is done, next step is to record the digital scan. But before that, gums can interfere. So to deflect the gums away, we use a chemical and a special thread. That's the digital impression. This is being done using an oral scanner. This digital scan is converted into an impression and a digital file is sent to the lab for fabrication. After the impression, temporary veneers are made and they are glued using a temporary cement till the time we are getting the final veneers. These are important to protect your teeth from sensitivity, plus it gives you some vanity also. Sometimes the temporary veneers, they look as good as the final veneers. Upper ones are the final veneers and lower ones are the temporary veneers, and both of them are closely matching. Once we receive the final veneers back from the lab, we check the fit on the model first before giving appointment to the patient. And in the clinical sitting, first we check these in the mouth, and once both patient and doctor are satisfied, we glue them using a special veneer cement. And we have a glue stick also to hold the veneers because these are very fragile. And there is a special 9-step method that we follow for perfect bonding. So once glued, they will not come out and they last permanently. Today, let's see some corrections that were done using veneers at our clinic in past few months. Patient reported to us with white stains in his teeth with some non-alignment as well, and these stains would not go away even with whitening, and she wanted to go for a permanent long-lasting smile. Upper 8 veneers were done for her and she was so happy about them that she insisted on going for the bottom 8 veneers as well. So in the video and in the process, you will see that the veneers we were done for her, and we opted for a B1 shade for a Bollywood-like brighter smile. Then next is the 7 veneers and a 1 zirconia crown done for a patient who was not happy with the shade and he wanted to get rid of the smoking stains permanently. He had a trauma also, and the zirconia crown that he had was anesthetic, and he wanted to change it. He wanted to go for a bottom teeth as well, but he had a crucial meeting. So for now, we did some whitening in the bottom teeth to match the B1 shade. Next is for a patient who comes from north and she got fillings done in front teeth multiple times, but there were food lodgement and there were bleeding in the gums as well. So she was not happy with this smile. So although the requirement was functional, but indirectly we did aesthetic correction also for her. 4 Emax crowns / veneers were done for her to improve the smile permanently and to give her a long-lasting solution. Next is of a patient who reported to us with long teeth. There were gaps also. She was not happy. So we did 4 Emax veneers for her. The length was also corrected. So you can see veneers can do a good job in a quicker time. So in just 7 days, she was happy with the newly restored smile. The next patient came to us with non-alignment of teeth. Initially, we did aligner treatment for him. Although the smile was corrected, the gaps were closed, but he was not happy with the size and the shape of the teeth. He had peg-shaped teeth and they look very small as per his personality. So for him, 4 Emax veneers were done. Teeth whitening was done for the bottom teeth to match the shade. It is a myth that veneers should only be done one time or it cannot be repeated. For this lady, she works in a corporate sector and the upper 4 veneers were replaced with 6 Emax veneers. In the end, I have a patient was not happy with the old fillings. The junctions were getting discolored. There were decays happening around the fillings. We did 2 Emax veneers for her. Technology is so advanced that with CAD/CAM technique, any kind of digital makeover is possible.